But what I'm saying is, I know you show me this direction, but this is more important at this moment. I told you regarding the 10 whatever. So this, you just rehearsal, so not think about it. Okay, that's good. This is the number one. I all the time talk to the technician not to do, but follow this, okay? Meaning the implant or combo cases is very complicated cases. So a bottom looks okay, made by Straman, whoever designed, that's good, but was wrong. Why was wrong? That one I would like to indicate it. So, meaning whenever I see this, the midline is here, you see, the midline, I cut it, and then here is a little bit too much, so I want them to grind it. I want them to grinding this area. Okay, why? So here's a 1-2s, and this is too close. So all the time look at the final contour. Then final contour draw like I did. So here is the central, here is the lateral, here is a canine, so I have to move it, and then I have to make another canine too. Here is my guideline. First, draw the guideline. So when you draw here from midline, it's too close. So they must grinding here, move it. Then I can make the better central here. So you know, whenever I draw, and this abutment is here. Here is more problem. Okay, more problem is the between here, technician have to weld it or redesign it. This one I need it. This is a good framework. You can take the shot, that was great, makes sense. I'm talking about the framework compared to what I finished finally. What I'm talking about, first dental laboratory technician made a mistake. They set up the final tooth is not serious as much they think. So we have to take the final contour considerably, and then I can move that area, and this area, like here, I have to move more. This is too tall, cut it. And same thing here, especially here's a problem, big problem. They have to weld it here, and then cut it, eliminate it, cut it. So, like I said, number one, you can go to 6-unit design. All the time you have to draw or you have to design with whatever you have a library. Okay, you have to design final contour. This is very imperative. Okay, so we're talking about the internal color. Internal framework. It's supposed to framework like this. This is the final framework, which is abutment. Very good. Then we make cap, and then we finish final. Same thing here. I have to make this. Okay, this is implant. Same thing here. I want to get position. I'm talking about implant abutment. So what I said all the time, okay? Please draw the midline what I did. Okay? And then draw the size of the tooth, how much bigger. I would say, if I say 100%, and this one's supposed to 70% around that, then 50 or 60%. We call golden proportion. Once you set up the one side, same thing. Once you set up the same thing here, 60, 70, here is 50 and 60, we call golden proportion. It's very important, right? So, and also, it's very important to, I know this is implant, it's a tissue line, tissue design. If we don't set up the tissue design, it will not look good, the final 6-unit cases, okay? And also, you have to get the the long axis. Let's concentrate this. Okay, number one, finish the midline, set the proper abutment inside. Okay, this is wrong, like I said. Then cut it here, and then we change this and move it here and there. Don't get confused. Okay, and let's K. One-to-one design. Fine. Midline, draw the line. 100%. Draw the line. 60-70%. Same thing K9. So it will be K9 will be overhanging here in order to make cosmetic design. Make sense? So this is number one. Dental laboratory technicians never listen. Draw the line. If we don't know how to draw the line, you have to keep on using your pencil, and then you have to draw. Then you can see, this is a huge problem. So this is number one. Okay. Number two, then you see the alignment. I have seen the alignment just like that. So we're trying to bring in as much as possible because I don't like the grayish see-through from inside. Because if I make the zirconia, I want kind of a little bit line of the occlusion line. Since this is under contour, which is fine. If I roll them, I make a little bit out, just like compared to same. That's the best. Then I can make the zirconia, make thicker, then we hide underneath. Color, no matter what we anodize or whatever, no matter what. Okay, then we can set up the frame design perfectly. That's number one. If dental laboratory technician make pretty cosmetic top of the line restoration, this is number one. We have to set the frame design abutment, and then I'm going to finish the final work, the best, to make this better contours, everything. Okay, thanks for watching. This is about exactly what I'm talking, first video, the second video, but this is different cases, but identically same cases. What I'm trying to say we have to set the midline from the here, okay? And then once you set up, then I see the 1/2 of the size, which is limited, we do have. So this and this is 8 and 9 a little bit bigger, just like this. Okay, now lateral, we have to move that direction, this the other direction, so make like this. Canine move it, and then premolar move it. Same thing here. Everything move it. That's why it's very important to design alignment. We anodize it, gold anodize it. After that, we put the composite with the gradient, light curing. Okay. And also, this is the final. The zirconia with the pink aesthetics like this. They will really like it here. Here's the final. Make sense? Alright, this is it. They have to little push it. Great translucency, the great symmetry. We're trying to pre-plan it so they can get. Now, here is the tooth prep, and this is our book, which is Dr. I made a long time ago, 15 years ago. Scale, round tips, shade tap, everything. Doctor gave us the temporizations, which is a little bit. That's one, and then this one is all zirconia linger, and then we finalize it with the highest aesthetics, side by side here. So this is the case. We made it, shipped the other side, so we make the room. The other one, like here, this is normal, and we can make that. So this is a unit finally accomplished it with the highest aesthetic they can get. Alright, that's why I sat down to talk to you guys, which is very imperative. Without those plans, you cannot get this. Even though those plans, you have to put some good ceramic layer with specific textures are made by these initial porcelain. Okay, thanks for watching. This video, like I said, we need a frame design underneath. You know what, everybody wants the great technician, and then I want to learn more about the technique. And I got all the time from the Instagram, Facebook, every time. So even technicians, they say, look, I won't be like you, all right? I want to do just like you do. Look, you look like you make a lot of money, all right? Please share with me, all right? I will share with you, okay? Please listen what I said. Please listen. If we don't get this kind of work, if we don't understand this kind of work, you cannot get it. You cannot present it as a 6-unit, 8-unit, top of the line cosmetic. This is only frame design. But people said frame design is easy, no problem, just make it. No, frame design is a top of the line. You need a frame just like my building. If you don't set up the building properly, and then you're going to collapse. Here's more problem. If we don't set up perfectly, I do have an aesthetic problem, which means the color, contour, especially color. So I want to put the more nuance and just a lifelike restoration, regardless of what they give to me. All right? I don't blame what doctor choose position, the implant setup, whatever. I don't blame them because they have a reason. Okay, it doesn't matter. So that's why we help the dentist too. So as long as I help them to my direction, we're trying to help the better see here and there. So we create the better frame, and then we make the great frame. And the next time, after we make the great frame, and then I can show you how to apply the minimum, the facial tenths, 2/10 to 10 millimeter, just like very sensitive, delicate. But we can layer, build up, cooking, and then final work. That's what I present for our clients. I hope you guys can help my video. And then I appreciate you guys watching my Instagram, Facebook. Thanks for tuning, by the way. I appreciate it, all right? I gotta keep going up. That's why you push me, so I'm going up. This is #1 session. But stay tuned on the #2 sessions. I try to help you as much as possible. Like I said, back to what I said, I repeat you, draw the midline, draw the tooth 100%, draw the lateral. It doesn't matter what inside. I set up the implant or doctor made the prep. It doesn't matter. Then I can see the occlusion view, alignment. That's why we make that. That's the #1 rule. I'm trying to share my secret with any penny. Probably penny. Thanks for watching. See you next time.